Free, your health promotion and disease prevention podcast brought to you by Kike Afia. My name is Biri Obogo. I'm a medical doctor and specialist in public health medicine. In today's episode, we're going to discuss 9 pillars of meal plans for persons with diabetes. So here is a short quiz for which I will share the answer at the end. So which nutrient has the greatest effect on blood sugar? A. Carbohydrates. B. Proteins. C. Fats. D. Vitamins. Or E. Minerals. I will share the answer at the end. Now, diabetes is becoming a common public health problem, and it's basically a chronic disease where the pancreas does not produce enough insulin, or the insulin that it produces cannot effectively be used. So this results into a condition called hyperglycemia or high blood sugar, which can in turn damage nerves and blood vessels, leading to blindness, limb amputations, kidney failure, heart attacks, stroke, and death. Now, there are two types of diabetes, type 1 and type 2. At type 1 diabetes, the body doesn't make insulin, and patients have to inject themselves with artificial insulin. In type 2, the pancreas does not make enough insulin, or the insulin doesn't work very well. So in terms of the best strategies for controlling blood sugars, one is what you eat. It's important that you eat 3 meals a day, preferably for 6 hours apart, and it's advisable not to skip meals. And the second thing is to know how much carbohydrates you are consuming. Ideally, you need to eat the same amount of carbohydrates at each meal. Let's say if it's lunch, breakfast, or dinner. And the other principle is the choice of carbohydrates. It's preferable to go for complex carbohydrates, or what you call starches and fiber, as opposed to simple carbohydrates or sugar. So simple carbohydrates include things like table sugar, juices, processed foods, white bread, things like white chapati, cornmeal mash made from refined maize meal. Those are usually called the simple carbohydrates because they tend to be digested quickly, absorbed, and they tend to raise your blood sugar quickly. So there are about 9 pillars of meal planning for persons with diabetes. And this include one, the micronutrient mix, that is how much carbs, fats, proteins are you consuming in a diet. Now the majority of calories, at least 55%, should come from carbohydrates. This includes all individuals, including people with diabetes. Now many people get surprised when they hear this because they've been told that carbohydrates are bad for people with diabetes. However, for you to get enough nutrients, you need to have a majority of calories from carbohydrates. Now fats should take about 25%, and then proteins 20%. The second principle is what type of carbohydrates are you consuming? As I said, you need to distinguish between simple carbohydrates, or what you call sugars, and complex carbohydrates, what you call starches and fiber. The kind of carbohydrates we are emphasizing are the complex carbohydrates, which contain fiber. Now, fiber plays a very good role because it slows down digestion of food, and therefore it ensures that the sugar is absorbed slowly and you don't have the spikes. Remember, carbohydrates also contain vitamins, minerals, antioxidants, and things we call phytochemicals, which are important for a balanced diet. The third pillar is knowing how many carbohydrates you're consuming. This is called carbohydrate counting, and there are various ways of doing it we shall be discussing in the next episode. So we can know your carbohydrates by things called exchange lists, reading your nutritional facts labels, weighing your food, using what you call the healthy eating plate, or you can just work directly with a registered dietitian. The fourth pillar is fiber. I said fiber is very important. In most cases, if most of what you consume is processed foods, such as I said white ugali, white chapati, or things like juices. If you're only consuming is meat, chicken, protein sources mainly, you're basically missing out on fiber. Now, it's recommended that in diabetics, you consume 14 grams of fiber for every 1,000 calories. So if you're on a 2,000 calorie diet per day, which is actually the case for most people, then you need 28 grams of carbohydrates per day. Now, remember, most people barely consume a third of that in their diet. You also want to avoid sugar sweetened beverages. Limit them, not actually avoid, but limit. You also want to limit your saturated fats to less than 70% of the calories. Now, saturated fats may mostly come from animal products such as beef, poultry, and also vegetable oils that are used for cooking. So you want to limit that less than 7% because remember there is a close link between diabetes and cardiovascular disease. So you want to reduce your risk of cardiovascular disease and the complications related to diabetes. The other thing to limit is trans fats. Trans fats are mainly industrial products which are made when vegetable oil is hydrogenated, turning it from liquid to solid. Now, trans fats are very dangerous. In fact, they're supposed to be eliminated from cooking oils. And they tend to increase the LDL, the bad cholesterol, to increase the bad cholesterol and reduce HDL, the good cholesterol. Ideally, the trans fats should comprise between 0 to 1% of your diet. Now, the other thing is alcohol. The idea is not necessarily avoid alcohol, but drink moderately. This is recommended 1 standard drink for women and 2 standard drink for men. But excess alcohol can lead to hypoglycemia. And lastly is weight reduction. There are very many benefits of reducing weight if you're diabetic, and this is mostly done through diet. You need to lose at least 5-10% of your weight in less than 6 to 12 months. The benefits are many because your blood sugar is better controlled. You tend to also require less medication, and if the weight is up to 10%, sometimes the diabetes can go into what you call remission. Remember, the weight reduction also lowers cholesterol, which is a risk factor for cardiovascular disease. So when we talk about carbohydrates, how many carbs are in the food? I mentioned that the majority of calories, whether you're diabetic or not diabetic, should come from carbohydrates, and it's about 55%. The way to know is what you call carbohydrate counting. Now, carbohydrate counting can help control blood sugar. Remember, carbohydrates in the diet increase blood sugar more than any other nutrient. It means that checking your blood sugar helps to identify where changes in blood glucose can be made. But there are other determinants of blood glucose levels, such as your physical activity level, stress, medication, or when you're unwell. Now, as I mentioned, one of the key aspects of meal planning for personal diabetes is monitoring carbohydrates because it's a key strategy for blood sugar control. There are various ways you can do it. I'll be discussing these things in detail in subsequent episodes. Exchange lists for diabetes. This is whereby food with similar amounts of carbohydrates, protein, fats, and calories per serving are grouped together. So for example, 1 carbohydrate exchange serving is about 15 grams of carb. So a third of a cup of rice cooked and 1 slice of bread or plantain are equivalent to 1 carbohydrate exchange each, meaning that you can exchange these foods within each list and still end up with the same amount of carbohydrates. The other method for counting carbohydrates is called the healthy eating plates, which divides a plate into 4 quarters. So you want half of your plate to be filled with non-starchy vegetables and fruits. Non-starchy vegetables include things like carrots, tomatoes, greens. The other quarter to be filled with starches, things like bread, rice, beans, and then the other quarter to with healthy proteins. Now, healthy proteins are things like poultry, fish, lean meat, as well as things like legumes, seeds, and nuts. The other method for counting your carbohydrates is what you call food factor system, which is calculating carbohydrate count by body by the weight of the food using a weighing scale, and then use a formula whereby you multiply the weight of the food times a food factor. Food factor can be found on standard tables, and that gives you the grams of carbohydrates in that food. Nutrition facts label is another way, and here this one is on packaged foods, and it usually gives you the total grams of carbohydrates. You can also work with a registered dietitian to basically help you in terms of counting your carbohydrates. So what are the foods that are containing carbohydrates? One I mentioned starches, are things like bread, cereals, rice, crackers, pasta. The other source of carbohydrate we call the starchy vegetables are things like potatoes, corn, peas. Then non-starchy vegetables, broccoli, greens, and carrots. As I mentioned, for diabetics, you want half of your plate to contain the non-starchy vegetables. Then dairy products also contain carbohydrates, things like milk and yogurt. Fruits and fruit juices also contain carbohydrates. The other sources include things like sweets and desserts. Now, non-carb containing foods include things like meat, fish, poultry, eggs, cheese, which are basically proteins, and then fats, oils, and water, which are basically fats, and then water. One thing we realize that these foods here don't contain any fiber. It's only these ones that contain some fiber. So what are the carbohydrate choices? If you're diabetic, what kind of carbohydrates should I eat? Remember I mentioned you need to distinguish between simple carbohydrates, or what you call sugars, and complex carbohydrates, which contain starches and fiber. So you need to go for whole grain breads as opposed to white bread, white chapati, or white mandazi. You also want to go for unprocessed maize meal, mash, things like millet and sorghum, and avoid, let's say, maize meal mash made from a processed maize. You want to go things like brown rice as opposed to white rice. You want fruits and vegetables, and avoid fruit and vegetable juices. You want to go for things like popcorn, nuts and seeds as opposed to chips and candy. You want low fat or non-fat milk and yogurt as opposed to full fat whole milk and yogurt. You want dried peas and beans, or what you call legumes, as opposed to peas or beans with added fat. And then you want to go for unsweetened beverages as opposed to sugar sweetened beverages. Now, one of the important complications of diabetes is hypoglycemia. And remember, diabetes is about high blood sugar, but sometimes your blood sugar can go very low, which is called hypoglycemia. Ideally, if blood sugar is below 70 milligrams per deciliter, that is called hypoglycemia. And the idea is you need to consume carbohydrates very, very quickly. In fact, if you're diabetic, you should be having some source of carbohydrate with you. So you will basically consume 15 grams of glucose is preferred, but any type of carbohydrates can do, like juices or candy. Now, half a cup of juice is the same as 15 grams of glucose. I usually use the rule of 15. So you consume 15 grams of glucose, you wait for 15 minutes, and then you retest. If it's not back up to above 70 milligrams per deciliter, then you administer another 15 grams. Remember, once it has normalized, you eat meal or snack to prevent recurrence of hypoglycemia. And remember, do not overcompensate by consuming, say, 100 grams of carb, because that can cause what you call a rebound hyperglycemia. So back to our quiz, which nutrient has the greatest effect on blood sugar? I mentioned it's carbohydrates. Remember, carbohydrates are digested in the mouth and intestines into simple sugars or glucose, which is then easily absorbed into the body. Proteins and fats are not digested into glucose. Vitamins and minerals do not contain carbohydrates, so they do not raise any blood sugar at all. So thank you very much for listening. This podcast was brought to you by KK Afya, your health promotion and disease prevention podcast. My name is Birio Bogo. I'm a medical doctor and specialist in public health medicine. You can support us in many ways by commenting, sharing, or subscribing to my YouTube channel. You can support us through this M-Pesa till number 766500 or this mobile number 0720 95 82 50. Tomorrow we'll be discussing how to count your carbohydrates using the so-called exchange lists. Until then, bye-bye.